A patient is any recipient of healthcare services. The patient is most often ill or injured and in need of treatment by a physician, physician assistant, advanced practice registered nurse, psychologist, podiatrist, veterinarian, or other healthcare provider. Etymology: the word patient originally meant one who suffers. This English noun comes from the Latin word patiens, the present participle of the deponent verb, patior, meaning I am suffering, and akin to the Greek verb I floron I micron I to the first I 1/2 and its cognate noun I. Outpatients and inpatients. An outpatient is a patient who is not hospitalized for 24 hours or more but who visits a hospital, clinic, or associated facility for diagnosis or treatment. Treatment provided in this fashion is called ambulatory care. Sometimes surgery is performed without the need for a formal hospital admission or an overnight stay. This is called outpatient surgery. Outpatient surgery has many benefits, including reducing the amount of medication prescribed and using the physician's or surgeon's time more efficiently. More procedures are now being performed in a surgeon's office, termed office-based surgery, rather than in a hospital-based operating room. Outpatient surgery is suited best for healthy patients undergoing minor or intermediate procedures. An inpatient, on the other hand, is admitted to the hospital and stays overnight or for an indeterminate time, usually several days or weeks. Treatment provided in this fashion is called inpatient care. The admission to the hospital involves the production of an admission note. The leaving of the hospital is officially termed discharge, and involves a corresponding discharge note. Misdiagnosis is the leading cause of medical error in outpatient facilities. Ever since the National Institute of Medicine unregistered trademark's groundbreaking 1999 report, OE to err is human, found up to 98,000 hospital patients die from preventable medical errors in the U.S. Each year, government and private sector efforts have focused on inpatient safety. While patient safety efforts have focused on inpatient hospital settings for more than a decade, medical errors are even more likely to happen in a doctor unregistered trademark's office or outpatient clinic or center. Day patient: a day patient is a patient who is using the full range of services of a hospital or clinic but is not expected to stay the night. The term was originally used by psychiatric hospital services using of this patient type to care for people needing support to make the transition from inpatient to outpatient care. However, the term is now also heavily used for people attending hospitals for day surgery. Alternative terminology: because of concerns such as dignity, human rights and political correctness, the term patient is not always used to refer to a person receiving health care. Other terms that are sometimes used include health consumer, healthcare consumer or client. However, such terminology may be offensive to those receiving public healthcare as it implies a business relationship. In veterinary medicine, the client is the owner or guardian of the patient. These may be used by governmental agencies, insurance companies, patient groups, or healthcare facilities. Individuals who use or have used psychiatric services may alternatively refer to themselves as consumers, users, or survivors. In nursing homes and assisted living facilities, the term resident is generally used in lieu of patient, but it is common for staff members at such a facility to use the term patient in reference to residents. Similarly, those receiving home healthcare are called clients. Patient-centered healthcare: the doctor-patient relationship has sometimes been characterized as silencing the voice of patients. It is now widely agreed that putting patients at the center of healthcare, by trying to provide a consistent, informative and respectful service to patients, will improve both outcomes and patient satisfaction. When patients are not at the center of healthcare, when institutional procedures and targets eclipse local concerns, then patient neglect is possible. Scandals in the UK, such as the Stafford Hospital scandal and the Winterbourne View Hospital abuse scandal, have shown the dangers of silencing the voice of patients. Investigations into these, and similar scandals, have recommended that the health service put patient experience at the heart of what it does, and especially, that the voice of patients is heard loud and clear within the health services. There are many reasons for why health services should listen more to patients. patients spend more time in healthcare services than any regulators or quality controllers. Patients can recognize problems such as service delays, poor hygiene, and poor conduct. Patients are particularly good at identifying soft problems, such as attitudes, communication, and caring neglect, that are difficult to capture with institutional monitoring. One important way in which patients can be put at the center of healthcare is for health services to be more open about patient complaints. Each year many hundreds of thousands of patients complain about the care they have received, and these complaints contain valuable information for any health services which want to learn and improve patient experience, patient satisfaction. Patients' satisfaction with an encounter with healthcare service is mainly dependent on the duration and efficiency of care, and how empathetic and communicative the healthcare providers are. It is favored by a good doctor-patient relationship. Also, patients who are well informed of the necessary procedures in a clinical encounter, and the time it is expected to take, are generally more satisfied even if there is a longer waiting time. See also. References. External links: Jadad AR, Rizo CA, Enkin MW. I am a good patient, believe it or not. BMJ 326, 1293 Euro 5 doi, 10.1136/BMJ. 326, 7402, 1293. PMCA 1126181. PMIDA 12805157A, a peer-reviewed article published in the British Medical Journal's first issue dedicated to patients in its 160-year history, so-called DK. How to be a good patient. BMJ 328, 471 doi, 10.1136/BMJ. 328.7437.471 A review article with views on the meaning of the words good doctor versus good patient. Time magazine's Dr. Scott Haig proves that patients need to be Googlers. A Mary Shimon's response to the Time magazine article, when the patient is a Googler,